Our chaplains really play a big role at the hospital here at Mission to help us with those situations where we have an imminent death. For example, somebody that's getting cardiopulmonary resuscitation, CPR, they're not responding to our resuscitation measures. Our chaplains play a big role because that person is deceased, even though we're still doing CPR. But we like to get the family members to see the resuscitation. So one, they can see what's going on. Two, to see that everything was done for their loved one before they died. But most importantly, so that they can say goodbye. And so what we do is our chaplains arrive at all of our code situations in the emergency department, whether it's a trauma, pediatrics, or a medical code. And they work in conjunction with myself to help coordinate bringing the family into the room to watch the resuscitation. We periodically, when we're doing chest compressions, will stop to check the rhythm, and we'll see that flat line, and I'll point out to the family, your father, loved one, whoever it might be, and I'll usually try and use their name if I know it, is not responding to our resuscitation measures. We've got flat line on the monitor. We're only going to go another 5 minutes or so. I want you to say goodbye before we stop. And it seems like a horribly traumatic thing to put them in that kind of a pressure situation. But what our experience has been is it's been better than anything we could have ever imagined, because family members feel like they got to say goodbye to their loved one before they died. In their mind, that person is still alive while we're doing chest compressions, and they can go over and talk to them. We put chairs at the head of the bed and ask them to talk to them. If they want to whisper in their ear, they can, hold their hand.